Hello, this slide presentation will be on birth control. Birth control is interfering with the reproductive process at any step from fertilization to implantation. So what are some of the methods that are used pharmacologically for contraception? You have oral contraceptives, you have implants, injectables, um, intrauterine devices, IUDs, you have the ring, and you have patches. Non-pharmacological methods include surgical sterilization, whether it's a tubal with the women or a vasectomy for men, mechanical devices such as condoms, diaphragms, cervical caps, those are also called barrier methods, and then avoiding intercourse during periods of fertility, which of course are the most unreliable. When selecting a birth control method, you have to consider the effectiveness of the method. You need to consider the safety for the patient, considering their other any comorbidities, and the personal preference of the patient. First, we'll discuss oral contraceptives. They work by inhibiting ovulation, and there are two main categories. You have the combination oral pills, and you have the progestin-only pills. With the combination pills, there are three subgroups, and those are the monophasic, biphasic, and triphasic. And usually what's meant by that is they have different amounts of hormone, where the triphasic would mimic more of the true hormone um, levels that present naturally in the body. Here are a list of adverse effects that you would see with the combination OCs. What are some of the benefits of taking an OC? They can decrease certain cancers, PID, benign breast disease, help with iron deficiency anemia because the periods would be shorter, and acne. We have to consider interactions with OCs, and here are some drugs that in particular have a good effect on interacting with the OCs. So rifampin, the anti-epileptic drugs, and St. John's wort. So drugs whose effects are decreased by OCs would be warfarin. Drugs with increases by OCs are listed here also, and those are some of the again, the anti-epileptic drugs, and also drugs that we use for in mental health. Dosing schedules, you have the traditional 28-day cycle schedules, and then you also have now extended cycle and continuous schedules. Your extended cycle is usually on a 3-month basis, and you can continue those cycles if you decide not to have a period, and continuous cycles. And those are very helpful for, of course, women that suffer with endometriosis, to keep them from having the painful periods. This is a schedule for missed doses, so you can read over that to see what you would do. Every package insert has those instructions on it. I usually would tell a patient if they do miss basically what to do, but of course at that time they are not really concerned with that, so I always tell them if you miss pills and you don't remember what to do, you've thrown away the package insert, to call the office and we can discuss with you how to take care of a missed pill at any time. This is these catch-up schedule for the continuous or extended cycle. Now we'll move on to the progestin-only contraceptives. There's several different brands, just like there are many brands for the combined OCs. One difference here is that they do not cause the thromboembolic disorders, headaches necessarily, the nausea that's associated with the combos. That's because they don't contain the estrogen. So that makes them slightly safer, but of course they do come with their own set of side effects. One thing is because they don't have the estrogen in them, they can be less effective than the progestin only. One important thing with the progestin only is that the patient should take it at the same time every day or within a 2-hour window. So they can't take it in the morning today and then in the late afternoon or evening the next day, because there could be a chance with that kind of dosing that they could still end up pregnant. They are more likely to cause irregular bleeding. Why? Because again, they don't deliver estrogen. The estrogen actually helps to thicken the uterine lining, and because that would be in preparation for implantation if someone is going to get pregnant, and that's in your natural cycle. So because that doesn't happen, the uterine lining can become uh, thin and dry, and that bleeding is from that dryness in the uterine lining. When I was doing a clinic, teen clinic for several years, many times I would have to give the teenagers some NSAIDs, which contain prostaglandins, which help. Sometimes I'd have to go ahead and give them maybe a month or two of a uh, combination OC to give them some estrogen so that they could build up that lining again. And then they would many times they would do much better, but sometimes that doesn't work. And then this is one reason they may not want to or cannot take a progestin only pill. Next, we will discuss the patch. The patch is placed once a week for 3 weeks, and then there's 1 week off. The adverse effects are similar to the combo OC, and with the patch, there is a restriction with weight due to the fact that if the woman is obese, the amount of fat cells that the medication has to transcend can decrease the effectiveness. Also, the patch should not be placed on the breast or near the uterus, so it causes a very limited rotation space for placing the patch every week. The contraceptive ring is left in for a month. So basically it's left in for 3 weeks and then removed. And you have a week for the withdrawal bleeding. And the symptoms are listed here. Under long-acting contraceptives, you have the implants. The next one on, which is one implant. This is the newest version. Of course, it started out as the Norplant, which had 5 implants. Then it went to 3, and now it's down to 1. It's among one of the most effective we have. And again, the biggest side effect is the irregular bleeding, for the same reason you have with any progestin-only type contraceptives. You also have the Depo-Provera. It's injected IM or sub-Q. It is given every 3 months. And again, the side effects are the menstrual irregularities or the breakthrough bleeding. And with this one, though, there can be some bone loss. So um, you have to make sure if you're giving it to a younger patient that they are well aware of this issue with the Depo Provera. Then you have your IUDs. They are among the most reliable. You have the copper T, which has been around for a very long time. It does not contain any hormones at all. And then you have your Marina. You also have a Skyla as an example of one of the newer ones. The newer ones are smaller. They're trying, such as the Skyla, they're trying to make them small enough so that a null tip can use them. A woman who hasn't had a baby, they can be placed because in past years you were only given an IUD if you had already had children. So that has changed, and I think that's changed, of course, for the better. The newer ones, of course, last for 3 years, but again, 3 years is a good amount of time. The Marina is 5, the Paragard is for 10. I know women not complain, but worry about having that placed, and there there is a risk of it embedding into the uterine wall, but that is not a frequent occurrence. Uh, the big thing with this, of course, is that you must teach the woman to check for the string every month, and if she can't feel it, she needs to come in to make sure that the string is still available. Um, Also, with the IUDs, you want to explain how they work, and how they work is that they create a hostile environment in the uh, uterine cavity so that it makes implantation uh, almost impossible for the egg, fertilized egg. And also, if it has a amount of progestin such as the Marina or the Skyla, then that is another protection against implantation. You have spermicides, which kill the sperm. They come in jellies, gels, suppositories, films. These are all can be purchased without a prescription, and they are only moderately effective if used alone, so they should be used with other methods such as a diaphragm um, or with condoms to increase their effectiveness. Drugs for medical abortions. You have the RU486, and it blocks the uterine progesterone receptors to make again a to expel the fertilized egg, and you can have bleeding, cramping, nausea, vomiting, diarrhea, headaches with that method. You can also take a combo with methotrexate and misoprostol. There's also the to not cause abortion, but to stop implantation. You could also take one of the morning after pills, Ella, which you need a prescription for. You have to take that within 5 days. It's high dose estrogen. Way back, we used to just have combinations of the different birth control pills and how many you had to take to do the same thing. You also have the progestin only with the Plan B, which is over the counter, and you can take that, but that has to be taken within 72 hours of unprotected sex. You also have use of prostaglandins, uh, for which again is the Cytotec, which can be used to induce abortion. It can be used, but it's popularly used to ripen the cervix during induction of labor. and also to stop the postpartum hemorrhaging. So the first question is, which patient would be at greatest risk of developing a VTE if a combination OC were prescribed? The answer is C, the 22-year-old who smokes 2 packs of cigarettes a day. Second question, a patient contacts a clinic nurse to determine the proper action after she forgot her OC for the past 2 days, and which response would be most appropriate? And the answer is B, to take the 2 doses per day on the following 2 days. So that is in your notes and in your book about how to decide on a catch-up schedule. Question 3, the nurse teaches the patient about Camilla. Which statement requires intervention? And that is D, the pill works primarily by preventing ovulation. And the prostaglandins, that is not what they do. They are weak with that. They usually help with implantation, changing the cervical mucus, making it thicker, harder for the sperm to penetrate. And question 4, the nurse instructs a patient in the use of combo oral contraceptives for birth control, which determines if the teaching was successful. And the answer is A, that she should avoid St. John's wort, and that was one of the medications mentioned in the presentation that affects OC. And that is it for today. Thank you.